Hi, I'm Dr. Bill Adams, and this is everybody's favorite show, No Spin Live, where you get the real story from the world's top plastic surgeons. So today we've got some great things to cover for you. We're going to talk about disappearing plastic surgery clinics and Albert Einstein, flesh-eating bacteria, and breast implant ALCL. So we've got a great group of surgeons that are going to educate us today. We've got Dr. Pat McGuire from St. Louis, Dr. Brian Brzezowski from Salt Lake City, and Dan Del Vecchio from Boston, Massachusetts. All right, well, let's get into our first topic, which is, we've reported this before, this is the clinic in Miami that apparently has changed its name and rebranded itself while keeping all the same doctors and personnel that's had a lot of issues with deaths from buttock augmentation. Dan Del Vecchio, I'm going to start with you. I'm sure you have quite a bit to say about this.
There are surgeons of all types, good, bad, ugly, and these doctors, they had some deaths, unfortunately. I mean, you could take the argument they probably should have kept their name and their reputation, and it's kind of deceitful. I would probably go on the side that it's a little bit deceitful on their part to try to change the name. They're trying to deceive the public into thinking it's not their clinic and their reputation, but I find it unethical.
Dan, but isn't it true that what has been found, and you've been integral in a lot of this research, is really the technique that is probably related to a lot of the poor outcomes and mortalities and buttock augmentation. So that's where Albert Einstein came into this, because he said doing the same thing over and over again and expecting a different result is the definition of insanity.
Yeah, I mean, it's definitely technique. It's patient selection, it's instrumentation, and it's technique. And so, if all you do as a plastic surgeon is copy someone's technique, we fall into the trap of really not understanding the concepts. But that's a higher level conversation. I want to bring it down to the level of the patient. These patients are traveling from all over the United States. They go to Miami because of price. The price is typically cheaper in Miami because of price pressure and competition. And, if you're flying from Minnesota or St. Louis or New York going to Florida and it's a different clinic, those poor patients have no idea to Google the former name.
Brian Brzezowski, what do you think?
Well, I think, this is very illustrative of the transition that has happened in medicine over the decades, where you would go to see a plastic surgeon or a physician, and you would go to see that surgeon. Their name would be on the sign out front, so there was never any confusion about who you were going to see, and you were going for the individual. Well, of course, we all know the business model has changed, right? So now we've got, these institutes that have cropped up and these aesthetic centers that go by these lofty names. Ultimately, what happens is that now we have these business names that have nothing to do with the personnel that are there.
Yeah, Pat, what are your thoughts?
Well, I think like Dan said, is if you're coming from someplace else, you may not have heard on the news about these deaths. And you could, if the name is different, how are you going to know? Because a lot of times, as Brian said, the physicians, they don't even know who the doctor is, who's going to treat them or is going to do their surgery. So they can't even look up that physician's record. So it is very deceitful. And you say patients do your homework, but how much homework should you be expected to do? Find previous names. It's very difficult.
Well, I think that's great information. Let's move to the second story. Now, this is actually, Pat McGuire sent me this story. And I have to say, it's almost infuriating for me every time I read the story and see what occurred in this case, and I'm going to be interested in your comments. The story is, as you know, some person that goes in has liposuction of the arms done, and subsequently, days later, actually dies from what's being called a flesh-eating bacteria. But what's not mentioned in the story, and what is salient, is that the people doing the surgery are actually OBGYNs. So what are your thoughts? What are the learning points and takeaways for patients?
This woman, mother of 3 in her 30s, had liposuction of her arms. It's a very low complication procedure. A few days after surgery, she develops a severe pain in her arm, goes and sees the doctors, and the pain is out of proportion. Even in one of his notes, the doctor said the pain was out of proportion to what they saw physically. Well, that's a sign of a potential significant infection, flesh-eating bacteria. That's kind of the red flag to us as trained surgeons. And this woman came back to them again. They drained fluid off of her arms and put her on an antibiotic. But again, they mentioned this disproportionate pain and did not do anything. A few days later, she went to the emergency room where she developed multi-system organ failure and died. What to me almost makes it worse is on their website, these two gynecologists have a big one whole section about why you don't need a board certified plastic surgeon unless you're having reconstructive surgery, that they're perfectly capable of doing any procedure that we can as board certified plastic surgeons. Now, there may be a gynecologist that does very good liposuction out there, but I think it's a crapshoot for patients if they're choosing someone who is not trained in plastic surgery and certified by the American Board of Plastic Surgery, which has standards and requirements for training and continued medical education. And our training in general surgery before we did plastic surgery, I think would have allowed any of us to have recognized this complication.
Plastic surgery residents now usually have had usually between 6 to 9 years of surgical training and specific plastic surgery training. And there are some other specialties. I mean, like dermatology has core plastic surgery or liposuction training within their core training, but these other specialties do not. Does that matter? And what are your thoughts?
These individuals are doing exactly as you said. They are doing things that they did not experience during their residency training. And we've known since the Flexner Report in the early 1900s that this apprenticeship style of education really didn't work well. So we created these educational pathways for surgeons and all physicians to learn how to be competent in their specialties. And what that requires and what ultimately ends up falling by the wayside is they need supervised training over multiple years in order to get the judgment that they need in order to be able to do these things safely. So if you're not experiencing these complications and facing these types of situations while in residency training and at least getting a baseline type of understanding of the things that can go on and how to manage them, then you're not getting that experience and developing that judgment that you really have to have others overlooking your decisions to really be able to gain.
Do you think patients should maybe research if the doctor actually has hospital privileges to do the procedure, because that's a good indicator typically of somebody's training that's been checked out? Is that something that you think is important?
I always think that's important, and I particularly am concerned in this situation that perhaps one of the reluctances that they may have had to properly treat this patient a little earlier in her course to potentially have prevented her death was the certain absence of any hospital privileges to take care of these patients and to further follow them through their hospitalization.
Del Vecchio, so I'm going to be the devil's advocate. Are we being biased? Are we just, we're plastic surgeons, we're all plastic surgeons, so are we being biased?
This is never going to go away. You know, it's a free country. The medical societies, the state medical societies aren't going to mandate special certificates. This conversation has been going on 50 years. Although I agree with everything, you know, better economy, access to information through the internet, and a blurring of the middle class is just changing the plastic surgery patient. And the plastic surgery patient wants immediate access, and they're not the patient of 30, 40 years ago, word of mouth, referral to that doctor. We're commoditized.
Nothing will erase, you know, the outcome here. It's unfortunate, but hopefully some people can take something away from this discussion and hopefully not have that occur. But I think those are all great comments. All right, let's move to our last story. This was actually just in the New York Times. It's on breast implant ALCL. Brian, a lot of things to talk about with this. This is obviously something that's been front and center. What are your thoughts about this article? And again, what's the message to patients?
Well, I certainly think that we're seeing more and more stories in the media about ALCL. And, you know, the FDA made their press release a few weeks ago, and certainly the media has picked up on that. I think, thankfully, the patients really haven't started to fall into this trap of believing that we now have this epidemic of breast cancer caused by breast implants. And certainly the title of the article is very salacious, and it's really inaccurate in terms of, breast implants causing this cancer. There's a lot of science that's really starting to be developed with regards to this disorder. We're really questioning the classification as a lymphoma. So we're learning more and more about the disorder and the potential causes of that.
Brian, you're right about everything you said, but welcome to like 2017. That article wasn't your patients who were like, yeah, yo, hum, oh, I think I heard about that. That was like, why breast implants ruined my life, why I had breast cancer, and then I got it a second time. I mean, that article was Connie Chung 20 years later to me. And if you think that you hear, this, that, and the other thing, I think this is a disaster. And I think we're just so close to it that we're like on the Titanic and we're just kind of sitting there going, well, nothing really much is happening because it's data points. Like you said, it's like, Gary Brody talks about ALCL 3 years ago. Then the FDA writes a letter in March. Now we got this New York Times article. I predict this is going to become a much bigger issue. I don't think that it's not because it merits it. It's because the same thing I said earlier. It's not the reality. It's the perception.
Don't you think, there's a big difference between 1992 and now, and namely that in 1992 when they said, well, what's the science behind breast implants causing autoimmune diseases? There was no science. Nobody knew anything. There was no data, zero, which now is very different. We know a ton about this entity, and we know much more than we knew then. So don't you think that's really apples and oranges to say it's the same thing?
No, I didn't say it's the same thing. It's not the same disease. The effect of the media on what is reality is similar. In other words, there was no association with silicone and autoimmune disease, but the media made it an issue, and the FDA took those implants off the market because they needed research. Now, we have alternative implants to textured implants, and if there's enough people out there dying of ALCL or getting ALCL and it's a media hype, I could see the FDA saying, hey, there's an alternative, just don't use these implants.
So Pat McGuire, you've been educating people on breast implants for over 20 years and doing a great job of it. I'm interested in your opinion. What are your thoughts?
I think this is different from 1992, as you said, because at that time it was a non-specific disease. I'm tired, my joints hurt, but this is a very specific clinical entity. It's something you can tell the patients. There's specific symptoms that show up. Your breast may become swollen, you may develop a lump. One of the things that I've done over the years is I've seen my patients every year. I've learned being involved in all the studies that I learn a lot from seeing patients year after year. My results have gotten better because I've learned what happens with time. And it gives me the opportunity every year to educate patients on this. And what we do know on ALCL is that it is associated with textured implants. It is usually presents with swelling of the breast. It happens with every type of implant, saline or gel, but all the cases where the implant was known was a textured device. We know that it's treatable if it's caught early. There's things we think we know about it. We think that it's associated with a bacterial biofilm that forms around textured implants and not necessarily the implant itself. And we know that there are things that we can do with the work that you've done over the years, Bill, that can lower the risk of those bacteria coming in. And we also know that it's very treatable if caught early.
And I don't fault necessarily the media. I have to say, I think part of the fault lies within the FDA because the FDA in their update didn't give a lot of information. Like, for example, some of the things you just noted, Pat, that it's never been seen in a smooth implant. In the United States, that's a huge number. That's probably 85 to 90% of all the implants in the United States are smooth. So all those patients actually probably don't need to be concerned at all. In the textured implant patients, it's a very rare phenomenon, so they should be counseled and educated accordingly. Do you think, Pat, in terms of the textured implants, what are you telling your patients who have textured implants?
Well, what I've been telling the patients is that, yes, there is an association with textured surface implants, that if they develop any symptoms, that they need to come to see us right away. If they have any concerns, we can always change them to a smooth implant, take the capsule out around the implant as well.
All right, well, listen, that's the type of information that we only can get from you guys, the world's experts on these topics. So appreciate all that. We appreciate you guys' time. We appreciate the audience's time. And if you would like to see more of this, you can see it on theplasticsurgerychannel.com.